Thank you all for joining us. I'm Lori Reeves with the Florida Perinatal Quality Collaborative, and I'm really only here to set the stage for a really interesting presentation from Dr. Jennifer Marshall. She and her team have been busy doing almost 200 interviews of women in Florida who have had recent birthing experiences. So we're going to talk just a little bit about what's happening with this process and what our next steps are. So we call this process listening to mothers' voices. Can we go to the next slide, Nicole? All right. And I want to start off, of course, by acknowledging the Florida Perinatal Quality Collaborative's vision and values. We have been in operation since 2010, and our focus is that all of Florida's mothers, infants, and families will have the best possible health outcomes by receiving respectful, equitable, high quality, and evidence-based perinatal care. We have always been voluntary, although last year the Florida legislature did pass a statute without our knowledge, or and it certainly wasn't driven by us, that requires all hospitals that deliver babies in the state to participate in 2 FPQC initiatives at all times. We are data-driven, we are population-based, evidence-based, equity-centered, and we strive very hard to be a value add. We want this process to feel like it has great value to the hospitals and partners that participate with us. Next slide, please. The project we're talking about today is Mother-Focused Care, and Mother-Focused Care is, as it sounds, focusing on the perspective of the mother and the care she receives. It includes everything from respectful care to health-related social needs and addressing those services. Of course, CMS in this past year has a new requirement for hospitals that they screen every person for 5 measures of social determinants of health. And beginning in January of next year, there's an additional requirement that hospitals will be reporting how, of the people who did screen positive for a need, what percentage were referred for services. So this project helps hospitals prepare for that. We have 68 participating birthing hospitals in the project this year, and that accounts for 64% of all the births in Florida. So it has a pretty good impact across the state. Next slide, please. We always want to acknowledge our amazing partners and funders. Many of them have been with us since the very beginning. Some of them are newer and have joined us in the last couple of years, but we're grateful for all of them and could not do this work without their ongoing support. Next slide. This slide is one of the framework slides for why this project on mother-focused care is so important. And we thought this was very impactful. It's adapted from a slide from the Institute for Clinical Systems Improvement. And we flipped it to be just a woman because this project is mother-focused care. But, you know, looking at this, 40% of health outcomes are impacted by socioeconomic factors, 10% by the physical environment, 30% by health behaviors, and only 20% by the actual clinical components of healthcare. Next slide, please. The global aim for the Mother-Focused Care project is to improve maternal health by transforming hospital culture and environments to respectfully serve all mothers and families, and by helping them meet needs related to social determinants of health. Next slide, please. And in order to do that, we always lead our kickoffs, mid-project meetings, etc., with stories from women and families that have been impacted by the issues that we're trying to address. And so one of the things we thought was important with this was to help hospitals hear from women in their communities who had delivered within the past year or so. And so we worked in partnership with Healthy Start, who've been just incredible partners around the state and have done a truly extraordinary job of recruiting women to sign up to do these interviews. And the goal was to anonymously capture diverse voices about the delivery care experience women have received. And this will help us and help hospitals address health-related social needs by understanding the challenges that women are facing, because the voice of a person is so much more powerful than just seeing something in writing or having someone tell you secondhand. Being able to hear her voice tell you about what her experience was like, what her needs were, and how her needs were or were not met is a really powerful tool. And we're going to have them available as audio recordings that will be shared with our hospital teams so they can hear. Next slide, please. These women, as I mentioned before, were recruited by Healthy Start. They're not all Healthy Start clients. I want everyone to understand that. They were recruited through a lot of different partners, community organizations, parent-child groups, and others, so that there would be a really good, broad, diverse selection of women who were interviewed. And we want to emphasize also the Healthy Start did all the recruitment, but Dr. Marshall and her team did everything else. And so they've been responsible for interviewing the women, and then they're going to go through a process of getting the recordings ready. She's going to talk to you all about that. Nobody's heard these interviews yet except for Dr. Marshall and her team. We're all looking forward to hearing the results. We're going to get a little taste of that today. And when they are ready, the information that the hospitals will hear will be completely scrubbed of any potentially identifying information. So the women's identity will be protected, which was one of the things we promised them when we recruited and interviewed them, is that nobody would be able to identify them as a result of their participation. So with that, next slide, please. I want to introduce Dr. Jennifer Marshall. Some of you have worked with her before. She's done a lot of partnership work with Healthy Start over the years, and also with the FPQC, but she brings with her a tremendous breadth of experience working with women and families directly about their experiences in the system of care from both a social and a clinical perspective. And with that, I'm going to hand it off to you, Dr. Marshall.
Okay, great. Thank you. Thanks for having me. You can go to the next slide. So I'm just going to share a little bit more about how we carried out this project and how we worked together with these groups to create this opportunity to collect feedback towards improving care. And I just wanted to recognize Early Childhood Comprehensive Systems. I work closely with ECCS Prenatal to 3. That's coordinated through the Florida Association of Healthy Start Coalitions, FPQC, of course, and huge thanks to the Healthy Start Coalitions who participated in this. And next. I also just want to recognize my fabulous team. Dr. Kimberly Fryer is an OBGYN practicing and also at USF Health. She's the co-lead, and also our project coordinators and the staff who made themselves available to conduct so many interviews in a very short period of time in such a kind and patient and friendly way that made it really comfortable for the parents to be able to share their feedback. Next. So I'm going to just go through the steps that we took just so you can understand how it was carried out. And if you have questions, you can always put those in the chat and we'll have plenty of time to cover that after. These are the steps that we took with Healthy Start to carry out the project. And it began by, as Lori said, Healthy Start would identify participants that would be eligible, given birth in the past year, ideally more recently, and had one or more socioeconomic need, and would register the participants in a dedicated Qualtrics link that we had. We also had a dedicated email for the project. And Healthy Start would conduct that registration just to reduce any possibility of fraudulent registrants if it was a public link. Once they were registered, next slide, if the participant was eligible, they'd given birth in Florida, in one of those regions, and if they agreed to participate, the registration led to a Calendly link where that participant could be signed up for an interview via video conference like this, or just by phone. at a day and time of their convenience within the next couple of weeks. And those interviews were conducted again through Teams or by phone. The camera was optional. The interviewers kept their cameras on when they were on Teams, just to be more personable, build that rapport. And I'll tell you a little bit more about the interviews in the next slide. Or the slide after that. So this slide, I wanted to mention, we gave the coalition's weekly feedback on the number of registrants, the number of completed interviews, and they had a secure folder where each coalition could access the list of registrants that they had signed up, so they would know who to send a gift card to for completed interviews. And then we are in the process of step 6, which is compiling and preparing those audio files to share. So the interview itself, this project was exempt from the Institutional Review Board because it's a quality improvement project. We explained a little bit about what the project and the intent was, verified the person's information before starting the recording. And then on the next slide, it has our interview guide. I know it's a lot of text, but and we'll share these slides after. But what we did is started with just asking for one thing that went well and a rating of their experience, postpartum experience overall. Just a very general question, a 1 to 10 rating of how they felt their care was. And then went on to just ask a little more details about why they gave that rating. So we asked for, we had prompts here for, was the care, did they feel their care was respectful? Did the staff at the hospital ask about their needs after the baby was born and provide referrals and assistance with getting additional support they may need? Did they ask them or provide information support specific to caring for the baby and caring for themselves? And also whether they had suggestions for improvement. Next slide. So here's what we accomplished. This was just in July and August. So in 8 weeks, we completed 163 interviews. There were actually 765 appointment slots available. That's a lot of availability. We didn't want it to be a barrier for parents to be able to sign up daytime, evening, weekend. And those appointments were offered in English, Spanish, and Haitian Creole. The interviews that were completed ranged from 4 minutes up to 36 minutes. On average, it was about 9-minute conversations. So these are relatively short conversations, but they were pretty rich conversations, as you'll see as we share back the results, and pretty in-depth. And you can see on the map here, it was a range of parents from throughout the state. Next slide. The parents themselves who participated in the interviews were pretty diverse in terms of their race, ethnicity, age, education level, marital status or partner status, and almost half had given birth within the past month. Several had children in the NICU. There's just a real range of families who gave their feedback. So, so we really just wanted to hear from them briefly about what their experience was like postpartum, what their needs were, and ultimately how to improve care from their perspectives. So again, there'll be much, much more detail to follow. I scanned or I read just a random sample of about 60 of the transcripts, 160 transcripts, and just sharing with you clips from those, their words, and some of the general themes that we are finding. But we're just getting started with that analysis as we finalize everything. So one thing that I want to share is nearly all rated their care as a 9 or 10. And of course my phone rings, sorry you guys. The participants really rated their care highly. Can you go up a slide, please? It looks like it was advanced. Thank you. There were a few that had lower ratings, and I'll share that, but it was very high overall. And the participants are really clear about what that mother-focused care or that positive experience consisted of. So you can see some of the characteristics here, that there was this sense of concern, of support, of kindness, of responsiveness. And so these were just a few of the quotes that came through. Those who had lower ratings, when we asked them, tell us more about your rating, sometimes it related to whether there were resources that they needed that were not offered or asked about, or maybe were not helped with in terms of something they needed that they needed follow-up with. So some examples here: lactation support, insurance, supplies, other referrals. Many noted that there was just maybe less follow-up or individualized care, or like prompt attentive care. Some noted feeling rushed or ignored. And in several ways, people expressed that they wanted the choice, that respect. So when information or services or suggestions were made, they wanted it to be made in a way that respected their preferences or their choice. So here's just one. I'm going to share 3 quotes today. This one was a good example of someone that had a lower rating. She said they were super helpful before the delivery, but after the delivery, I felt like they just kind of left me hanging. The nurses didn't really check very often. And you can see here when we asked about a need for supports, no, I didn't really need the services, but I wasn't really asked about them either. And this participant's suggestion was check on the patient more often. I mean, I know they want to give the new mom a chance to bond with the baby, but a lot of times maybe the mom needs more support from the nurse without being alone. So that gives you an idea of what that participant's experience was. We also asked a lot about what postpartum parents need when they're in the hospital before they go home. And some of the general themes that have come up were that, again, as I mentioned before, they need that, that responsiveness, that follow-up, that care. They need the information, the resources, and supplies. And that supplies, what came up quite a bit was things like formula and diapers, but also some of the needs related to their home, safety, work. One example was someone who didn't feel safe at home and needed help getting situated somewhere safe. Another brought up concerns about having time off from work. Lactation support was something that came up many times, a really important need, the follow-up with that and the care, ongoing support and care. And then the final theme here is accommodation or welcome for other family members in the hospital. So that includes that, that patient's partner or co-parent, younger relatives, so their children, care for that, and also older relatives that might have, say, mobility issues, all the way to meals and other aspects of accommodation for their family. Okay, next. So here's the second quote, and just an example of what a patient said in terms of that attentiveness and follow-up. So they gave me a booklet and they went over the booklet with me. They also have an iPad. At the end, when I was getting discharged, we kind of talked about the pregnancy and then after having the baby postpartum. and the books. They went over each and every single page, like for about an hour, and they spoke about anything if I had a question. So there's a real sense of that person really taking the time to make sure that that patient had all the information they need, that their questions were answered. So again, there are many, many examples, and we'll put that together for you, but vivid examples. And here were a couple of things, also some quotes that I thought were really important to bring up. One talks about just feeling like they were treated equally, feeling that they weren't being judged. And also the quote in the middle is about just everyone being attentive. So we hear a lot about all the staff. We hear about the nurses as well as the other staff at the hospital. So there's, I think, one more quote that really encompasses this on the next slide. So this person, I'm just going to read the beginning. I love the way that they treated me. A lot of women told me, like a lot of my friends tell me, like, oh, they don't really pay attention. You just say it's a job for them or whatever. No, they treated me like I was #1 priority, and I loved it. Every single nurse, every single doctor, everybody, like it was great. So I just think that was a really nice, again, example of what that that mother-centered care feels like. Next slide. So we are going through all 163 transcripts, listening to the audio and ensuring that the transcription is correct, so that we can do some more analysis to really identify, again, those themes, those characteristics, those recommendations, and synthesize that for all of you. As we're listening to those audio files and reviewing the transcripts, we're making sure all the information is correct in terms of like where that patient's located, and also making sure that there's no identifiers. We asked them not to share that information, but if there was any date or detail or name, we're making sure that that's removed from the audio and the transcript. So these are completely anonymous. What we'd like to do is group those files by county or region, depending on how many there are, again, to ensure anonymity. And we're going to convert them all to MP3 files just so they're easier to share. The coalitions have been busy following up with participants to make sure they received a gift card. They have secure folders for that. And the audio files will be kept completely separately and scrubbed for any identifiers. And those audio files will be shared with coalitions and hospitals as soon as they're ready. And that gives the coalitions, the hospitals, everyone a chance to meet at the end of September, early October, to review those stories from their region and reflect on those. I think maybe Lori, did you want to follow up with a few comments?
Yes, thank you. Thank you, Dr. Marshall. I've seen some of the additional information that they've collected, and it really is a powerful body of work. I think we're all going to appreciate hearing more as time goes on. But right now, we're really excited about the fact that the interviews, the audio recordings are going to be ready, many of them by the end of September, the rest of them certainly by early October. And the team is working very hard on that and making sure that every hospital has access to audio recordings that represent their community, understanding that they're not necessarily women that delivered at your specific hospital because they're going to be de-identified. And so you're just going to hear recordings from women in your community, and that's okay. It doesn't have to be hospital specific, but we hope that that will be a powerful tool for you. And next slide, please. What we are hoping and expecting that hospitals and coalitions will do is set up meetings to sit jointly, share those recordings, talk about the findings and kind of explore ways of how hospitals can use that information to improve care in their hospital and in the community and in our state. And we have with us today Margie Boyer, our clinical nurse lead for the Mother-Focused Care initiative, and she's going to help lead conversation for questions and answers. But do we have any other slides after this one? No, that's it. So if you want to look at more materials around Mother-Focused Care, our website address is on that last slide. There is a PDF version of those slides available that will be shared with anyone. And we've also recorded this, so you'll be able to see it. And before I hand off to Margie, I want to say thank you, Margie, for her leadership working with the hospitals. Also, the rest of our team, Jonna Johnson, has been working with families. We have Linda Detman, who's our director of operations and queen of the universe at the FPQC. I think she knows everything about everything. And then also Nicole Pellegrino is running the meeting today. And I can't go without mentioning Dr. Sappenfield, Bill Sappenfield, who's been our fearless leader for many years and is close to his last week before he retires. So I just want to give him a shout out for his vision and his leadership. And with that, Margie, take it away.
Okay, well, this is going to be a very informal Q&A. You can either unmute yourself, or if you're shy, if you just like to chat in your question, I'll be happy to ask the team. And I just want to thank everybody also. The representation, I noticed many of my nurse colleagues out there. I think there's over a dozen hospitals out there, so I know many of you may have questions. And Dr. Marshall, fantastic work. Healthy Start, thank you for recruiting the patients. And your team, Dr. Marshall, interviewing is just fantastic. I don't see any questions yet, so I'm going to start with one. How did you ensure, we have a lot of Hispanic, Haitian Creole. How did you ensure, were you able to capture those patients, and what was the, do you have any details around that?
We did really encourage that patients with at least those three languages would be recruited: English, Spanish, and Haitian Creole. We've been doing research in those three languages for at least 10 years in my team. And we have diverse native speakers of those languages. There was an opportunity to schedule separately for interviews with those languages, but actually Maria Pacheco, who did the majority of the interviews in Spanish, took it upon herself to sign up to conduct any interview that was scheduled with even a Latinx Hispanic sounding name, just in case that participant might be more comfortable switching, even if they didn't sign up for Spanish. So the interviews offered in Haitian Creole, we had speakers as well. The materials were in that language, the guides were in that language. So again, patients could have or participants could have the opportunity to switch back and forth if they chose. All of those interviews are being transcribed into English, but we have the audio files in their preferred language.
Great. So the hospitals will be able to hear. You'll actually get them transcribed. They'll be able to hear what all these people had to say. That is fantastic. Wow. We do have a couple questions coming in. One from Regine Cansey. I don't know how to pronounce your name right. Were you able to assess the impact of culture competency and language access on services?
So that's an excellent question in terms of, how we were able to, and I'm so please keep the questions coming, because we're in the process of analyzing the results now to try to synthesize what we've learned. So we will definitely look for that to see if there were a lot of times when asking about quality of care or family-centered care, there might be some reference, and it could be very subtle, to cultural competency in their care. We'll make sure that we code for that in those transcripts if in any way that aspects of cultural or linguistic competency came up in any of those conversations. And we do have a very, very diverse and, like I said, a really skilled interview team. So we wanted to make sure that any participants in the interviews just felt comfortable talking about whatever their experience was in all aspects of their experience. So so we'll look for that. I can't think of examples right off the top of my head, except some of the quotes that I shared about people feeling like they were treated equally, that they weren't judged, that they weren't treated differently because of their background.
Yeah, it's a great question. Thank you. Mary Jo, you have your hand raised. You want to unmute?
Yes, thank you. I'm trying to process the information that was shared that the stories or the reports that we get may not be specific to our community. I understand the need for the anonymity. I understand that they need to be blinded. I'm just trying to process that, maybe understand how, if there would be alternative ways for maybe the coalitions, or to, even if it was just in writing that we got a transcript, maybe we didn't hear the voices, but I'm struggling with, if we're not getting information that's specific to our community, how does that, I understand on a global, on a larger scale, how that helps us, but at a community level, is there something we can do to address that?
I think for grouping these, go ahead, Bill.
Data. You should be getting your own county's data. So it is your community.
Yeah.
So it's
Okay.
not the whole state. Assuming that your county has enough pieces of information. If your county does not, then it'll be a coalition or a region.
Okay.
Right. We're just looking carefully. If there's small numbers, we would just expand it to a region till there was
Okay. Thank you.
enough of them that it wasn't potentially identified.
Okay. I got it. Thank you for clarifying.
We want to protect also both the mom, but we also want to protect the hospitals. And so it's really about trying to get the information out there without pointing to an individual.
Yeah. Yeah, that's good clarity that it is your community.
Okay. Thank you for setting me straight.
Yeah, that's a great question. No, thank you. Anybody else want to raise their hand? We do have another question in the chat from Aisha. Is there any resource hub or guide that we can gain access to better serve our families and be exposed to what is out there? I recently moved to the area and really want to know what's available in our community. Great question. Who wants to talk?
Margie, I'll jump in. This is Kathy Tamutsa. I'm with the Florida Association of Healthy Start Coalition. So, Aisha, I'm not sure which area you are from, but an exciting part and important part of this collaboration on this project is that your local Healthy Start Coalition in your hospital area is working with you. They have developed a resource directory and are meeting with your hospital representatives. Maybe you were not a part of the meeting yet, but there is a resource directory out there. I'm not sure. You can text me in the chat if you like, and I'll help connect you with your local Healthy Start Coalition if you like.
Thanks, Kathy. I figured you'd want to take that one. That's awesome. I'm so excited about those resource directories. Bill has a great question. Maybe one of the hospital nurses out there, or some of our leaders out there. Those are high satisfaction scores. Were you surprised? Anybody want to unmute and tell us how they felt about those high scores? I know we have Nancy Travis out there, and Lindsay and Andrea and Krista.
Jennifer, what are your thoughts too?
Jennifer.
Well, I mean, from a research perspective, a lot of times folks that are willing to participate in an interview either have a great experience or a terrible experience. I was really like surprised and thrilled to just keep hearing 10, 10, 10, 10, 10, but I think that was a wonderful thing to learn, that so many patients had like such a really wonderful experience. And I think that does, again, it helps us to understand what's important to them and what that looks like and feels like. So it's, we didn't take a random sample, but I think there were so many interviews from across the state. It makes me feel comfortable in hearing the results that it represents what's happening out there. And there, you know, again, we have to finish the analysis to let you know out of the 160 what proportion maybe had less than a high rating, but overall it was pretty good.
Lindsay, did you want to respond? You have your hand raised.
Yes, thank you. Just about being surprised or not, and because I was the one recruiting the moms, so I got to talk with a lot of them, and I agree with what Jennifer said, that they the ones that actually did want to register and move forward were very enthusiastic about it because they had such a great experience. So I think that just happened to be, they were more than willing and excited to do so because of the very wonderful experience they had. So I wasn't surprised to see those results.
Anybody else want to respond to that? I know there's a lot of nurses out there, and I think we have a couple OBs as well. Jennifer Powell, fellow nurse, what do you have to say?
I'm not necessarily surprised, just because I've seen the survey results for like the HCOPH surveys across our entire system. And historically with this particular population, they've been higher than they are for other different types of populations, generally because they are happy, they gave birth, they generally had a good experience. And I also know our nurses at the bedside are absolutely amazing. So I wasn't necessarily surprised. I was just happy to see that it was so many that were rating it 9 or 10 out of 10.
Yeah, I know as a nurse, you know, nurses and doctors, everybody that provides this care just so looks forward to this feedback from the HCAP scores, from Press Ganey, and then something like this. I think it's going to be such a motivator. Nurses and doctors and clinicians have been through such a rough time. Just getting this feedback is so exciting. Thank you so much. Anybody else from any of the hospitals have any feedback or a question?
There's a question in the chat, Margie.
Okay, I'm following along. Let's see here. We've got the resource guide. It's been a long time, but from my recollection on studies, people want to please the researcher. Was or will that be taken into consideration when presenting the results?
Yeah, we try to always be really transparent about the potential for maybe a social desirability bias for a participant in an interview to want to give the right answer, a positive answer. We really did our best, again, to make sure that that we let participants know we didn't work for the hospitals, we're completely separate, to make sure they felt comfortable giving all feedback. We had multiple prompts saying, you know, that's wonderful. Was there anything that they could do to improve? The hospitals really want to improve care. So we just, again, it's really in just how we conduct the interviews. But we always recognize that there is a possibility that folks may hold something back, or those who have concerns maybe didn't participate. And that just kind of comes with doing a large scale project like this.
If I can add, I mean, that's part of the reason we did the methods we did. We didn't have the hospitals recruit mothers. We went to an outside community entity to actually recruit the moms so that they could not be selecting who would be interviewed. It's not perfect. I'm just saying we really have tried from the start, and Jennifer's done a wonderful job of carrying that out.
Okay, let's see. We have a couple people that joined a little bit late. If you have any questions, feel free. Let's see here. Lisa commented, thanks, I have nothing that is helpful, but I have noting that is helpful, and it is great. The feedback was so positive. Okay. Oh, you have nothing to add, maybe. Okay. And let's see. Do I see anything else? Anyone else in the chat? I do not. Anybody want to raise their hand or have any more feedback at all?
You do have a raised hand, Karen Wolf.
Oh, Karen, please speak up. Hi, Karen.
Hey, Margie, how are you?
Good.
Well, you know, and just listening to all this and hearing the fact that there is some good feedback. you know, I just give praises to my hospitals because in our area, because I really feel like that the nurses really do a great job. I know that, you know, there's staffing issues, things going on with that. And it seems like the negative comments get heard 100 times louder than the positive comments do. And the negative comments are the ones that people tend to dwell on. And then a lot of times the positive comments go a little bit unnoticed. So for me, I'm really pleased with, you know, seeing this. And I do feel like that there was a few moms that were pretty honest. I mean, for somebody to say maybe a 6, you know, and it was her first baby. You know, a lot of times when moms are with their first baby, they really don't know what to expect. So, you know, but it's good to know. I mean, I feel like for me, I think it's positive. And like I said, the negatives a lot of times have a larger impact. And it seems like people, you know, gravitate towards that, and they seem surprised when there is positive stuff. So for me, I'm just happy to hear the positive.
Great.
And I do think there will be a lot of detail, Karen, a lot of detail that will help point out the wonderful things that staff are doing that parents really appreciate and need and want, and also very concrete areas, ideas for things that could be changed. So I think it'll provide both, which is really, really nice.
No, I agree with you, Jennifer. I feel like it's going to, you know, let them see the overall picture and where they feel like maybe that, you know, they can improve on. I mean, there's always room for improvement, but, you know, I'm a little bit partial to nurses. I think they're pretty much the greatest people on the planet.
Well, thank you. That was great feedback. Wow. We also put a couple resources in the chat. One, Dr. Marshall put in some resources that they have out there. Hopefully you saw that in the chat. Sarah, also from the FPQC, has put in the chat our health literacy course, which is out there. That thank you to the Baptist Health people that helped us get that that course available for contact hours. Let's see here. So that's the health literacy course. So speaking of Baptist Health, Colleen or Lisa out there, anybody, do you have any comments at all from your areas in the Baptist Health system? I don't want to put you on the spot or anything, but
hi Margie, it's Lisa.
Hi Lisa.
Nice to see your face. No, this has just been so interesting, and you know, I kind of feel the same as the last commenter that, you know, I'm just so proud of the nurses here at Baptist Health, and especially at South Miami where I work. I think we do a great job making moms aware of what their options are. And, you know, we give them so many resources to help them be successful in the labor room. You know, it's definitely a labor of love on our part.
Yeah, thank you for that great feedback. I figure you all would have some comments. Go ahead. I'm sorry to interrupt someone.
And Bill has his hand raised, Margie.
Yes, Bill, go ahead.
I just wanted to give a special personal thanks first to Kathy and Paloma and the Healthy Starts. When we asked to do this crazy project, they actually listened and loved the idea and embraced it. Even though Healthy Starts have taken on a lot of new activities this year, they said this was a priority, and I want to thank you for fitting it in. And then among faculty members at USF COPH Public Health, Jennifer Marshall is one of the most busy faculty members I know, but she loved this project and said, we're just going to make it happen. And I just want to thank Jennifer for reaching into personal time to actually make this take place. Thank you to all of you.
Thank you. Thank you. I think this is actually going to be wonderful for ECCS and Healthy Start too, because I could recognize in some of those descriptions, it sounded like the patient was talking about maybe a conversation with a Healthy Start worker potentially too. So that'll be neat to hear. And as for the timeline, Bill, for all of you, as we go through these files and finalize them, we will share them as we complete them, starting probably next week. So we won't release everything at once. We'll release them as soon as they're ready, because I know, again, it's been just a couple of months, this entire project. So, so we want to make sure that folks have time to schedule and review.
Yeah, great job. We've got some applause going on. Any other questions or any feedback? Any feedback from nurses, OBGYNs out there, Healthy Start, social workers? Anybody out there want to have any comments or last questions? I know with over with 90 people on the call, it's always hard to get people to speak up. Oh, Mary Jo says, thank you for the opportunity. We love our hospitals. How sweet. Thank you. Nancy, you just turned your camera on. Did you want to say something?
I did. I just wanted to thank the Healthy Start coalitions because we've lost we knew that you all were out there during COVID and so forth, but this has really helped us to work more closely together. And I've had visits from Healthy Start of Southwest Florida, as well as the Collier County and Charlotte County, sorry, forgot my geography. Healthy Start coming into the hospitals and really helping with our team. So this has really promoted that. And I think it's all good when we can work together with our partners.
Thank you. Thanks, Nancy. Great points there. It's great to see Healthy Start back. Let's see. I don't see any more questions. Did I miss anything, Lori or Jennifer or Bill? Anybody?
No, just want to encourage everyone to reach out to us by email if you have any questions, and definitely explore the resources. We have some great training opportunities like the health literacy course, which is free. And we encourage you, if you think it would be helpful for you or your team, to sign up and do that course. And take a look at the website and see if there's anything else that would be useful to you. But and I just would also say I'm not at all surprised by the positive feedback. And I would remind everyone we can learn from the positive as well as the negative, because when women are citing specific things that they remember as being powerful and meaningful in their hospital experiences, those are things that we can replicate, double down on, expand, scale up, etc. So there's a lot to be learned from the positive as well as the negative feedback, but I am not at all surprised by the positive.
Great. And we've got a lot of thank yous coming in, and yes, the PowerPoint will be available. Well, this has been just wonderful. Dr. Marshall and Healthy Start and FPQC. Wow. This is great. In hospitals. It's great to see so many hospitals on. I'm impressed. Wow. Is there any last summary words or anything from anyone?
Just fantastic job facilitating questions, Margie.
Yeah, it's the least I can do. Well, I am just so, this is right up my alley. I just love the voice of the patient, and it's so impactful for nurses and doctors and all the clinicians, all the team members to hear and to have Healthy Start being looped in when they hear that feedback. It's going to be awesome.
I have one last thing.
Yes.
One last thing. Thank our funder.
Yes.
United Health Group provided the majority of the funding for this, and without it, we wouldn't have been able to do this project. So I just want to give them a shout out as well.
Yes, thank you. All righty. Well, we'll have this all recorded and PowerPoint goes out. And thank you for all the accolades too for Dr. Marshall and team. All righty. So thank you all. Have a great day.
Thank you.